Hi, and welcome back to the channel. This is Dr. Nell. Hope you all are doing great. So, as I announced on the community, we're going to have a few changes, that will benefit us. My concern is with public health, how public health is viewed. We see ourselves as citizens of wherever we live, and I see myself as a global citizen, and that's what I want you to see for yourself as well. And in being that a global citizen, our biggest concern in many cases is about health, public health, how we take care of ourselves, how we view ourselves, what our concerns are. And so on this channel, I'll be discussing a lot of issues centered around public health, but I'll be doing it in the simplest forms. We'll simplify it in a manner where everyone could participate. So our concern is not just with preventative health, but our concern is with health overall. And so as we travel, we go from community to community, or we go overseas, wherever we are, our discussion will focus around public health. What makes it accessible? What makes it more accessible? And why are many people in the community not using the resources that are available to them? Is it a lack of understanding? Is it that we are marginalized, or socioeconomic status prevents us from reaching out to members of our community? Forgive me, I'm a little nervous. It's cold outside as well. This is my first time on camera with you guys, so bear with me. So reaching out to the resources within our community. So we'll talk about it. I'll venture to have various members of the community have discussions with us from episode to episode, or series to series, depends on how detailed we are. Do we have part ones, part twos? Is it something that we're following through on? But whatever the video is and whatever the concentration of our topic may be, we'll always focus on public health, making sure that you understand what you need to be doing for yourself, and not just as adults, but for the elderly, for children. We want to make sure that the issue of ageism is discussed as well, and that we know health is something that spans the lifespan. It's from birth until the end of the journey. And so we'll do that. There's also motivational tidbits, and I'll try to combine these things as we go along. And as we go along and I see the needs of the people who communicate in the comment section, and I see the needs of the community, and depends on where I am, because the need here in North Carolina may be different versus me being in Puerto Rico or St. Lucia or Barbados, or Jamaica or Trinidad. It depends on where I am. Sometimes I might be in Switzerland. Hi, Manuela. That's my friend from Switzerland. Sometimes I might be there. So it depends on where we are, and we'll discuss the issues, and we'll compare as well, because as we journey along, we could compare what we see here in the US with what we see in Canada, what we see in Switzerland, what we see in Africa, to what we see in Jamaica. So let's get ready. Let's get on the journey. And today we're just going to do a walk, and I'll mention a few things, and just for you to get familiar with what we're doing. We'll always be somewhere scenic. We'll always be walking or sitting in a place where relaxation and comfort is the key. And so we want to make sure that you could find a happy place. You could find somewhere where you could discuss your issues as well as seeing something scenic. So let's take a little walk today and see what happens, okay? Nice to have you here. Let's go. Yes, so we're just taking a stroll. This is what it looks like. The sun is bright. It's beautiful, but it's chilly. So I know I've spoken to a couple people, and the reason I decided to get on camera and start doing this is that I've had a few discussions with members of the community, mostly our older population, and parents with children who have disabilities of certain forms. And with the change in our economy, with the restrictions and the increase in medications, we find that a lot of people are concerned that the things that were so accessible are becoming harder for them to access. The cost, the distance, the resources, and they're just concerned. And I understand that, and I usually tell people that not everything has a cost, but the cost is always going to be your health. So we need the information, we need to have discussions, and we need to ask questions. What is it that concerns you? Is it that there's a fear of being in the health center or in the hospital? There's something people call the white coat syndrome. They'll have all these questions, but once they get to the doctor's office, there's a certain amount of anxiety. And I understand that. And I always tell patients it's important to make notes of the things that concern you. You go to a doctor's office and they're limited to sometimes 20, 30 minutes, depending on the amount of patients they have. Or you go to the emergency room and you find that you're there for so long waiting. But before you make any appointment, or before you make your appointment and before you get to the provider, I always suggest make a note of your concerns. Keep a little journal for yourself of your health concerns, because sometimes the thing doesn't happen all at once. Sometimes it takes days or weeks or months. But if you have a notebook that you're jotting things down, then it makes it easier for you to explain what your concerns are or what you expect from your provider. Now, isn't it nice? The sounds of nature. Now, as we go through the health system, we find that not everyone access the system for the same reason, of course. Some people access it just to maintain health. Some people have chronic diseases, long-term issues, because we're going to try to keep it layman and as simplified as we possibly can. So I'll try to eliminate many medical terms and just use jargon that is easy to understand. So some people have an illness that will last forever. Some people have it may be something they could take care of in days or weeks. It may be months. Whatever the concern is, you want to be able to understand the resources that are available within your community. How could you access it? Sometimes you could go to a free clinic. There are times where they'll have blood pressure checks. They'll have diabetes checks, for your finger stick. Sometimes you could be able to pick up the phone, and even local communities, dial your information number and ask questions. In certain areas here in the States, it's 311, and you get 311, you get basic information, and you ask them, hey, I live in this area and I wanted to know, where can I get health information? Where can I find a place that could tell me where I could get food banks, or where I could go to get my blood pressure check, or I'm running out of a certain finger stick thing that I need, and I need these. Is there any way that carries it discounted? Or, sometimes our insurance companies, some people have insurance, like Aetna used to do it, where you could call them and they will tell you where certain resources are best available. But a good place to start is 311. And a lot of people don't use that resource because they think, well, the information there is not health related. They could point you in the direction of where your pharmacy is or where your health center is. So it's important for us to know our communities, know what we desire, and ask the questions. And I think a lot of times it comes down to how public health is perceived, and is there a budget that fits public health and public health information. This is a quiet neighborhood, and most times the only thing you see happening here are cars going by. We have health centers and churches. There's a fire station ahead of us to the left, but more than anything else, it's really quiet. Yes, guys. So, as I was saying, the hope for the channel and for our community and for people in general, those who are subscribed, those who are here just viewing, is that we get a better understanding, not just public health for ourselves, but public health and what we should do to ensure that we're using our resources. As you travel around your community or your state, your country, wherever you are, you want to be confident in the ability to pair traditional medicine with what a lot of people call original medicine. I believe that the two things can coexist and should coexist, but I always tell patients that it's important for you to say to your provider, hey, I use this herbal tea, or I take this herbal medication, or I've been doing this, For example, in Jamaica, people take soursop leaf, they use it to make a tea, and they say it's good for your blood pressure. Or another example is something called red clover blossom that people say is good for diabetes. There may not be studies there for these things, but they've grown up on it, and they'll say grandma did it, grandpa did it, and they believe in it. But now we're in an age where you take your blood pressure medication or you take your insulin. And when you go to the doctor, it's important for you to say to your doctor, hey, I drink red clover blossom every day. And the doctor may or may not be aware of what that is. And you let them know. And they'll do the research, or they'll say to you, hey, once you're taking this medication, do not take this while you're doing it. You understand what I'm saying? Let me know in the comment section. So I want for you to understand the importance of knowing what is acceptable, what you want from your provider, what you need from your healthcare team. And so you'll be better able to understand what your focus is, what the goal of your health plan is. Because every time you go to the provider, there's a health plan. There is something the doctor wants you to do, or something the doctor says you have achieved. And don't feel discouraged, or don't be embarrassed to say to your provider, hey, I don't understand. Could you explain it to me? Sometimes you could even take the phone up. There are many providers have, especially when you use a clinic, there are nursing hours and nursing appointments. And what this appointment is where you could make an appointment, and just like you would meet with your doctor, you would meet with your nurse. And the nurse provides education on your blood pressure medication, your diabetic medication, education on what you should be doing, what you shouldn't be doing, how to better understand. And from your nursing appointment, you can also get pharmacy appointment. For those clinics that have a pharmacist attached, there are many pharmacists who are more than willing or able to let you know more about your medication, explain to you what is contraindicated. What that means is what you should not take in combination with something else. Should you be drinking grapefruit juice? Should you be having orange juice? Simple things like that. Just an example. So this is what I want you to be aware of. To our left, we have a senior citizen center, and these resources are very useful within the community, because what we realize is that friendships and relationships, the things that keep us smiling, keep us happy, and enhance our life. And so when you are at a point where you could go to the community center and you could play bingo, or you could go and play a little golf, or just a walk with a group of people, it changes the way you feel, the way you think. And that's very important. Quality time spent with people who understand your situation changes how we look at our own health, changes how we feel about ourselves. And that's important. On the channel, I also provide motivational shorts. And it's my voice. It's not an AI. It's not somebody else telling you something that you cannot relate to. It's a realistic motivational short based on my experiences or the experiences of people I mentor, because I do mentor. And it's supposed to give you a little tidbit. So you could go in and watch those, and I'll always provide those. I have hundreds that I've written, and I'll keep recording them and posting them on the channel, and it gives you something to come back to. If there's a moment during your day where you feel a little, not say totally out of it, but you're exhausted. Life is a lot sometimes. The people you interact with can be heavy to carry their energy. And sometimes you just need a little bit of motivation, a little bit of something to keep you going. Then that's the place to go. You could communicate during the community posts. Sometimes I'll post something on the community post, and it's open also to the public. So if there's something on your mind, if there's something you want to discuss, then that's also a good place to post something, and I'll get to it, and other members will speak on it, and we could have discussions, And if there's something in the comment section that I see that deserves its own video or its own short, then I'll make a short to address whatever that concern is. This is our lovely park. Nobody's out here today playing tennis. It's too cold. Well, it's too cold for me. Anything below 75 degrees for me is just too cold. But we're just taking a stroll. And I want you to, when the days get a little bit hectic, it doesn't take a lot to change your mood. Listen to a short. Take some deep breaths in and out, Inhale, hold it for 5 seconds. Exhale. Just take your mind to a place where you are not thinking about that thing that is holding you captive at the moment, but release it in a deep breath and change your perspective, change your view. And I'll always be here. Today it's unscripted. I'm just talking from emotion, and as I told you, it's my first time on camera, so you've been used to hearing my voice. And being on camera like this, yes, it can be nerve-wracking, but I'm here. And just as I'm here for you, you'll be here for me, I'm sure. And we'll take trips together, and we'll see places, and we'll talk about health, and we'll discuss the things that are important to you, that are important to me, and we'll make discoveries as we go along. This is another section of the park. The pools are closed today. The children are not out swimming. Too cold for that. But it's a beautiful day. It's chilly, but the sun is beautifully sitting on the landscape. So we're gonna walk for a little bit more, and there are topics to come because, as I said, I want to talk to community members, the people who use and offer public health, the people. A lot of us don't understand that even our dentists provide a public health service. Our teachers are big part of how our children view health. It's not just the clinic and the hospital, but we could almost relate every and anything back to public health. You know, a walk in the park, the way our government organizations set our neighborhood, the resources that are available. Even a park like this improves and impacts your public health. Anything that adds to your life can be considered or argued into public health. Even our food banks, as I was saying previously, that a lot of people, based on your health diagnosis, their expenses are of such that the things that they would want to consume, the foods and the vegetables and the juices, sometimes it's based on expenses inaccessible, not in the quantities that your body would require it. And so getting to your 311 operator and giving them your location and asking, where's our closest food bank? That could help you, because then you go to the doctor and you're eating more fruits, you're eating more vegetables, you're taking more walks. There you go, public health. And your health becomes improved. So it's not just what we see in the books, and it's not just what we hear politicians talk about. We want to delve into the people who are using these resources, the community, the people who create a stable foundation for our children, for our parents, for our grandparents. We want to view our parks, our lakes, and we'll talk to teachers and we'll talk to people who work with the vets, and we'll go to the little parks. Children take school trips, and we have school trips that go to petting zoos. And a lot of people don't understand that these petting zoos become a part of the public health process, especially for children who are on the spectrum, children with disabilities who have to learn social skills. They have to do speech, they have to do ABA, and the more resources that are available and the more their parents are aware, because a lot of parents have children on the spectrum and they're so confused and they don't know where the resources are, and they don't understand that the child may be young now and you put them in a stroller and you walk around with them, but they do need speech therapy. They do need to be in a school that offers certain services, and social workers are here to help. They're here to perform a public good, a public service. So we're going to talk to these people and let them tell us how and why they got into it and how they can help to improve service for you. Okay? This is our beautiful lake. And we're not going to spend a lot of time here today because this is just an intro to the channel to let you know what we'll be doing. But we'll have walks and we'll have talks like this. On this side, this is where you could learn to fish. So the children come out and they rent the equipment and they get a chance to learn how to fish. And it's very relaxing. Grandma, grandpa and the children, mom and dad and the kids. This road used to go all the way through, but they closed it off to ensure that the parks are safe. No one is speeding. A lot of people use these for their children, especially during the summertime. And we'll be back here during the summer and during the spring, and you'll see the difference. People come out on their row and they take their kids there, and it's just a beautiful place. It's somewhere to relax, to take your mind away from the things that could be consuming you. So as we go along this journey together, no matter where I am, what country I'm in, I will always find a place where we could have a discussion, not just about the heavy things that are concerning us, because these topics are heavy. This is how we use the resources. This is how it impacts the length of our lives, to be honest, Our public health resources impact our longevity, and we have to take that seriously. So we'll always find a beautiful spot where we could come out and we could sit, whether I'm doing it on my own or I'm doing it as an interview. We'll find a beautiful place and we'll have a seat, and I can't have a drink, but you could have a drink. You could have some popcorn, you could have some fruits, got some strawberries, if your thing is seltzer water, ginger ale, whatever it is, do your thing and we'll have a discussion. And I'm here to empathize, to support, to teach, just to be a friend, to conversate. And it will always be centered around your health. Opportunities to improve your health. So welcome to our lake. And I hope to see you back here shortly. Here's a gentleman on his kayak. It's a beautiful day. Thank you for being here with me. Thank you for being here with me. It's been a pleasure, and we'll see each other shortly. From me to you, stay positive, stay motivated. Thank you. See you soon. Isn't it gorgeous? So let's think of our health, think of the things we want to achieve, think of the things that make us happy, think of the things that we could improve. And as I said, as we travel, we'll have further discussions. This was just a light-hearted introduction to me, to the channel, and hopefully as we grow, we adjust and we make healthy compromises. Thank you so much for being here with me, and I wish you good health and a wonderful journey.